So I'm Mahesh, I'm Head of Meds Optimization at Spirit Health. So medicines optimization, as has been the case for a while, has been around trying to identify the best value medicines for patients to help them get the best out of the medication. The important thing is making sure the patient's involved in that decision making. You can do that through different ways, through text messaging, through a phone conversation, letters, etc. But being able to engage with the patient is really important. Equally, it's important to make sure that the cost savings and high quality prescribing continue to happen within the NHS. As we get older, patients are on more and more medication. And often what happens is, as you have a medication, you often get side effects, and typically what happens in the NHS or within general care is that another medication is prescribed to counteract that side effect. But as we get older, that could mean that you end up on 5, 6, 7, 10 plus medications a day, and that's a lot for someone to take. Added to which you get drug interactions and equally can cause harm to the patient. We know this is an issue. The challenge is deprescribing and taking those medications away from patients is quite difficult. One, because it's a time-intensive piece of work. Two, it's quite complicated to know what to take off and what the impact of that's going to be. And the third aspect of that is the patient confidence in being able to separate the anxiety from being on a medication for however many years and then all of a sudden it being taken away from them. So it's important that when you do that, you have regular conversations with the patient and you do any sort of deprescribing in a structured way. So often within the NHS that's done through a structured medication review with a pharmacist or a clinician who will sit down with the patient and work through the medication, understand why they're on that, what the risks of them being on that is and what the benefits of them being on that medication is. We recognise that that's quite time intensive, both for the patient but also from the clinician perspective, and we all know within the NHS there are some challenges around waiting lists and patient demands, etc. Polypharmacy and the management of polypharmacy has been a priority for the NHS through the NHS England Medicines Optimisation national indicators for the last 2 years. It'll probably continue into the future years as well. We also see that being a priority across other devolved nations as well with deprescribing of medication. The reality is it's done in small parts. It comes back to the time and the intensity that's required to be able to deprescribe a medication. So it happens, but it doesn't happen routinely. Going back to the points that I raised earlier around confidence for the patient, clinician and the time required to do that. We've come up with a model to support patients and clinicians with their deprescribing journey. We utilise our software tools that we've got built in our CliniTouch software, and that works with the patient to allow them to complete question sets which are both clinical and broader lifestyle question sets to understand actually how the patient's getting on. We can then RAG rate that and understand generally is the patient well in terms of the medication and their deprescribing journey, or do they need some additional input from the clinician. We then utilise all those data points to then make some dose recommendations or dose change recommendations to help the patient step down and help the clinician with that step down decision as well. So that's what we try to do within deprescribing. Give us a shout if you want to know a bit more about deprescribing and how we can help you within Spirit Health.